mechanical nociceptor. Okay, noci means pain receptor, and it responds to a probe with a blunt object, a pinprick stimulus, and a tooth forceps is recorded as an output of a force transducer coupled to a stimulator. What could be the interference from this? If you see here, step number 1, 2, and 3, it is a blunt object. Probe with the blunt object. It is not showing any response. There is no response to the stimulus. Stimulus is there, the force is there, but you cannot see the response. In second, it is a pointed object. It is a pinprick, and you can also see the response. Okay, so this is about the stimulus. You can see it is a stimulus, and this is the response. So in second pinprick, we can see the response. In the third tooth forceps, you can see this is the stimulus and this is the response. Response is intense. You can see if you compare, here it is dense, here it is dense, here it is rare. So you can see the response is having greater intensity in the case of tooth forceps. Okay, now let me read the options. There are no response from nociceptor when stimulated by the blunt forceps. It is true. Option 1 is true. Okay. Pinching with the toothed forceps cause stimulation of mechanoreceptor but not nociceptor. No, we can see toothed forceps produces mechanical as well as nociceptor both. So this is false. Option B is false. Pricking with a needle does not stimulate nociceptor. Pricking with a needle also stimulate nociceptor as well as mechanical both. So this is also false. Sharp pain sensation is carried by C fiber. No, sharp pain is by A delta. We know there are two fiber. One is called as A delta, first pain, and C, second pain. A delta is usually myelinated. It is myelinated. C is usually unmyelinated. Unmyelinated. A delta is usually for first pain. Initially it was called as fast pain, but now Gerong says first pain, and C fiber is carrying second pain. First pain is called as good pain because it you tell you the intensity of the damage, the location of the damage. It is called as good pain. C is carrying the bad pain. It is a dull, diffuse, psychological, and the neurotransmitter for A delta. It is a glutamate. Neurotransmitter is glutamate, and here it is substance P. It is neospinothalamic tract. It is paleospinothalamic tract. So sharp pain is carried by A delta, not C. So we can see correct answer is A. So mechanical nociceptor respond to high threshold mechanical stimulus, meaning they typically do not respond to light touch but are actuated by intense pressure or damage in mechanical force. So you can see here blunt object can produce the mechanical reading but not nociceptor. So here answer will be A. So already you know about nociceptor, already you know about everything, but the thing is how to approach that knowledge in the exam. For that, your brain should be completely open. You should not be under stress. Only then you can utilize. And the most important thing, you must always practice doing MCQ beforehand. Because although you have knowledge, but if you don't practice in the exam also, you will fail. So try to solve MCQ beforehand. 70% of your energy after covering the syllabus should be utilized in doing MCQ, 30% for revision of your own notes.